Well, good afternoon, ladies and gentlemen. As been introduced, thank you. My name is Gerald Pilkington. Until March of this year, for the previous 5 years, I was the national lead for home care reablement within the Department of Health's Care Services Efficiency Delivery team. Very friendly little team who will be dear to all of your hearts, I'm sure. We didn't get too many Christmas cards. And what I'd like to try and do is just give a quick overview of reablement and some of the work that OLM are starting to open up and how they may well be able to help councils to deliver. You're absolutely right. 149 of 152 councils with social service responsibility have said that they have reablement services. But we know from data from those councils, we know from visiting those councils, or we did know when I was with DH, that they were actually getting to about, at best, 50% of the people who would benefit from reablement. And from a performance level point of view, they were probably hitting performance levels of about 30-35% when we'd be expecting to see 55 to 60%. So many are doing it. There's a long way to go. Home care reablement, I've got 15 minutes or slightly less than that now to try and cover and give you a flavour of what we did within 5.5 years of work and where this is now going. So I'm going to have to get me through quite quickly. Home care reablement, though, is about trying to help people to maximise their independence. It's all about helping them to do rather than doing it for them. And there is clear evidence from the body of evidence from across the country and from Scotland and from more recent Wales and from abroad that it does work. And what do we mean by work? Well, with conventional home care, we know that after the first 6 weeks of conventional home care, roughly 5% of people, despite everything we've ever done, don't need any more support. And about 71% continue on the same packages put in place on day one. That is a common story across the country. I've spoken to over 140 of the 152 councils, and only one council has ever said that does not reflect their experience, but they weren't able to tell me what their experience was. So that is pretty common, willing to be convinced otherwise. We know from reablement service, this one was in Leicestershire, it was evaluated by the De Montfort University, that at the end of the reablement phase of at that time 6 weeks, 58% of people did not need a home care package. They hadn't changed their FACS criteria, they hadn't changed any of their eligibility, same eligibility criteria as they were using with the comparison group. So we know it can increase people's independence, we know it can reduce the amount of ongoing care they need. We also know from a longitudinal study that across a number of sites that we worked with at the end of the reablement phase, the average there in fact was 60% of people did not need a home care package. And 2 years later, 40% had still never needed a home care package. So we know it can deliver benefit for people. We know it has a duration of benefit. And if we were to apply that experience to councils across the country, and I've called it an average council. So what I've done is I've taken the population of England and divided it by 152, because that's how I derive my mathematical average, that's it. So there probably isn't any one council that this is exactly right for, but it's the average. But if the average council were to adopt reablement and were to achieve decent, not the best, but decent levels of penetration and decent levels of performance, then they should be seeing savings of about 220,000 hours, reduction in commissioned hours year on year of about 220,000. And if your local hourly rate is £15 an hour, that's equivalent to £3.3 million. And if your average hourly rate per contact time is £20, then it's £4.4 million. Which is why 149 councils of 152 have been trying to work towards reablement, as it were. Out of all that work, out of all that engagement with councils across the country, as I say, and done a little bit of work in Scotland, albeit with the joint improvement team level in Scotland, there are some very clear issues, and this is an area where OLM are possibly going to be able to help you. Certainly there are some points for councils, and this is does not just relate to reablement actually, it relates to any project. And one of the most common areas that we saw was inadequate project management. Councils were trying to launch or move into a reablement phase or a major transformation phase without actually looking at it in the whole and treating it as part of a whole range of services. They were treating it in isolation, inadequate amount of project management time, inadequate project management skills being applied. Another critical point for councils, and that ties into the sort of top-level buy-in as well, is that services like Reablement need to become the default route. They're not a bolt-on, they're not an optional extra that care managers can say, yes, I'll send someone into it, or I won't send someone into the Reablement. It needs to become the default route. This is the route you're taking, unless there's a very good reason why you are not. Otherwise, you just won't get the level of penetration that you need to make it economic and to deliver the benefits for the individual as well as for the council. And also, there are very commonly, councils bluntly, in my experience anyway, are not good necessarily at performance managing their services. They're not good at operational performance management. And that comes about needing to know data to run the service around volumes of people going through the service, duration in the service, contact times, the performance, how many people are leaving the service not needing a care package, how many are leaving with a reduced package, and what does that mean? What does reduced mean? Is it reduced by an hour? Is it reduced by an average of 5 hours? Is it a reduction of 10 hours? How long are people appropriately moved out of service? They don't need a home care package, but are they coming back to you within a week, a month, 3 months, 6 months, a year, 2 years, 3 years? And commonly, those are areas that councils struggle with when they're trying to implement Reablement, and I believe other areas, other major projects. So some of the topics, some of the points perhaps for IT departments across the country, I would suggest, is that I believe, certainly from my experience working with services, that I would break data and information into 3 crude levels, very crude levels. There is information that they need to enable them to manage individual cases. The Geralds, the Pauls, the Harrys, the Janes. There's a level of information that the manager needs to manage the service. And I have to say, and I've said it to councils, but to their faces as well, in many forums, that when I met with some of the services and said, okay, I understand how you follow Gerald through, but how do you manage the service? What information do you use to run your business? And the eyes glaze over a bit. And some say, I'll get the performance people in the room. And some people say, I'll go get the IT people in the room. And I'm saying, fine, but you're the manager of the service. What information do you use to manage this business? And there's also a level of information that's needed to report on the service. And commonly, when I've visited and worked with councils, some of them, not all, some will have a stack of information, but actually, day to day, I don't need to know the ethnic mix of the clients coming into the Reablement service. It has no relevance to me whatsoever on a day-to-day, week-to-week basis. So, some of the points I would suggest, and this is where I believe the IT departments and other professionals in the council can help the service managers, is helping them to think about what information do they actually need. I've seen some services where they'll produce monthly a report of, and I'm not joking, 40, 50 pages. How am I ever going to distill that and get a feel for how this business is running? Too much information, too much irrelevant information. So, I think the IT departments, in addition to running the systems, can help them think through, what do I need to know to run my business? And when do I need to know it? The data needs, and information needs to be relevant. And I think if the services are using the information, then you're going to get better use of the systems, because they're going to be relying on the systems to provide them with that daily, weekly, monthly information. That is their source. The other thing I would also say is, and although the 149 are up and running now, I would still encourage IT departments and finance departments and HR departments to get involved early, because commonly services will be set up and they don't think about what system needs they have, what information needs they have, until it's further down the line. And you actually need it up front. You need it at the beginning, so you can compare it to your baseline and know how much progress you've made. We know, I know there are public sector cutbacks. I know I'm aware of that, but you'll also be aware, I think, that there is some specific money that's been made available last year, this year and next year in two main slices. And there's a letter that I've referred to there, NHS Support for Social Care. It's a letter issued on the 13th of January by David Flory and David Behan, who are both the NHS and the Director General of Social Care. And it sets out the first tranche of money, 150 million for this year, has been passed to primary care trusts to work with their local authorities to develop local reablement services, to increase capacity for reablement in its widest sense, not just home care reablement. The funding may be passed to councils, or the PCT may retain it, but they have to agree it with the councils. The second slice of money, this year £648 million across 152 councils, must be transferred to councils. It was handed to primary care trusts, it must be passed to councils, and it is to be used to spend on social care, which can also benefit health. So there is money in the system to try and create capacity on reablement, home care reablement, and the wider reablement agenda. And it includes telecare, it includes crisis response, it includes rapid response. So there is some money available. And in fact, there's a third tier, albeit much smaller. And because acute trusts are not going to be paid for certain readmissions from April of this year, already happened, that money, they are required to put that money in to top up the 150 million line. How many councils know how much money that's going to be? Might be a question you would like to ask. There are a number of examples of very good reablement services around the country, and I've been allowed to share one of those. Norfolk have agreed that we can share theirs. There are other examples. The Norfolk service, Norfolk First Support, the basic eligibility criteria overview assessment is undertaken by Norfolk Care Connect, who also deal with items of community equipment, small items of community equipment, aids to daily living. The reablement team, Norfolk First Support, work with people, as they've said, in an intensive way for up to 6 weeks, principally people from hospital, but not exclusively, but most of them are from hospital. Other services work with people from the community and from people from hospital. And they've seen, and this is their data, in the period June to July this year, for instance, 70% of people did not require a service after the end of their reablement phase. And there are other examples around the country. So in summary, I've tried to give you it's very quick because that's trying to summarise about 4 or 5 years' work, there is some money around. I know that there are public sector cutbacks, but there is some specific money around for reablement, home care reablement and aligned services. I would suggest to you that there is a limited window that councils have to really improve and make that step change. And if there's anything that you want to talk to us about, Simon Paulson here is at the front, or you can put it on your evaluation forms. If you'd like to come and talk to us about it, we'd be very happy to do so. Thank you.